1 and 2. 1 and 2. 1 and 2. Yeah, we're going to talk about the numbers 1 and 2 today, really quick. What I want to talk about, and some of you may deal with this often, hopefully you don't deal with it very often at all, is what's going on when you're getting just multiple episodes of 1 and 2 visit authorizations. This can be super frustrating, and I totally understand it on the side of the provider. And oftentimes, it's going to come down just a couple things. A lot of times, these can be very easily fixed, and we're going to talk about that really quick. So hopefully this is a short video. Again, if you have questions, let me know. If you would like to get more information like this, please follow me on Instagram at A Witty PT, or you can join us at our group. We got tons of people, tons of smart people in the group at Dark Secrets to Skilled Care over on Facebook. Or you may even catch some of my videos on YouTube. Go to my website, awittypt.com, get more information. But to the subject at hand, 1 and 2 visits only. So you send in the required information for an authorization. You wait the time period and you get information back saying you're just getting maybe 1 or 2 visits. So the first thing that I'd recommend is make sure you are finding whatever authorization notification that was also sent with that. The letter, the fax, the email. Different companies notify you in different ways, but then you need to read whatever that rationale is. Find out if it was a full approval or maybe a partial approval, however they word it. But hopefully there's some information in there to indicate why just 1 or 2 visits were approved, especially if you had made a specific request for, let's say, 6 or 8 visits. There's got to be a reason why they only gave less than what you were requesting, okay? So that's the first thing to do. Get that information. Now the second thing is to go back and see the kind of information that you sent to them. And if you're not the one sending the information, check with your office coordinator, whoever it is. And that letter that you got will often give you a hint as to if there's information that was missing. I would say this is the number one reason why you would either get 1 or 2 visits, especially in multiple times, is I have seen providers time and again, all they do is they send in a request with no clinical information attached at all. I think what is happening is your office person or whoever starts the request in hopes that the provider is then going to finish it. The provider, is going to finish it. That finishing never happens. So all the authorization company has, whether it's a third party or the health plan themselves, all they have is this. They have a request that says we're requesting care starting on such and such a date, and that's it. So then what they do often is they will give 1 visit, maybe 2 visits. They can look back at the previous history and see, okay, well, this patient had a pretty serious injury or a problem. They probably need a visit, but this provider needs to send us information. So they're kind of dragging you along in hopes that, okay, they're going to use this visit and they're going to give us the information that we need. And again, that letter that you get from them should let you know that there was missing information, or maybe the case was, there was a hold placed or a pending status or something of that nature, okay? So then from there, next time you request authorization, send the information that is needed, whether it's a standardized score, whether it's range of motion, whether it's pain scales, all of that. Make sure you're getting that information in. Now, another reason that you could be getting just 1 or 2 visits is that patient doing a lot better than they were, or is that patient plateauing? Now, again, the letter should probably indicate that the patient has reached a certain level, about that 80% level of being able to do their daily activities. I wrote a blog on that. Go get it in the website, in my blog. But also the patient may have flatlined. You may be sending information, but it could be that for the past 3 months, their function has barely changed at all. Their range of motion has not changed. And maybe that 1 or that 2 visit were supposed to be used to get some information and refer them to a physician or a specialist to get them the help they need. So those are some of the things you want to check on, and those are the primary reasons why you'd be getting just 1 or 2 visits. The only other primary reasons I can think of is potentially an error may have occurred in the processing of the episode, your request for authorization. But those are the things you need to check on. If this is something that is habitually happening in your practice, especially with multiple patients, there has got to be some sort of a processing error, more than likely on your side, also potentially on whoever's doing the authorization side as well. And my guess is going to be that there is a lack of information being provided, so those clinical reviews just cannot happen. If there's no information to review, then they're going to give you few visits, or they might give you 0 visits at all. So hopefully that was helpful, because I completely understand getting multiple 1 and 2 visit authorizations has got to be super frustrating. It makes it hard to just see a patient for a while and know that you've got these visits for a time frame when you've got to fill all that stuff out again and send it in again. It's not easy, and it's got to be a huge pain. So I'm trying to help alleviate that pain a little bit. So get that information in, check those authorization letters that you're getting back, and make sure you're understanding what's going on. If you have questions, call. Request a peer consultation, whatever options you have, so that can be explained to you. Hopefully that was helpful. I'd love to hear your comments, any other concerns, questions, things that you want me to address. Let me know. Get in touch, and I'd be happy to help you out. Have a fabulous day, and we'll talk to you soon. Bye.